she gets. There we go. All right, so yeah. Thank you guys for coming. Really appreciate it. I want to, there's lately I've been trying more and more to do education and outreach on things like how to protect us from the surging fraud, like especially online fraud and phone calls, to bring people in the state to do trainings, making sure that people have access to healthcare, so all the basic needs that we have. And I just asked for it because we had a feeling right before the holidays, having a lot of people getting here physically is not as easy. So thank you guys all for coming. I would be a little more intimate because we have a small group and you just can't get right over. What I wanted to communicate is the Community Health Advocates Program is a state funded program. In 2023, we put about $5.4 million into the program. And the reason why is because so many people are having difficulty navigating their healthcare system, including insurance. We're getting, I say this all the time, I have the same health issues that I deal with. Why am I getting this bill payment? Why am I getting it twice? Why was this one not covered? Doesn't make any sense. Why was it covered last time? This time, or why just do this doctors? Now it's not covered. Where in the heck am I supposed to find if someone's in network, if someone's not in network? This person used to be in network. How do you know when they changed? Right? Sound familiar? Like, right? So the whole purpose of doing the community health advocates is recognizing that there's a huge barrier to access because of the logistics, those experiences, and to make sure that we all have support and we don't feel alone to actually navigate that system. So it's a statewide, as I said, a statewide program that is paid for, and it is distributed through, we affectionately call them CHAs throughout the state, and the Human Services Coalition is our local CHA, Community Health Advocate. So if someone calls our office and is looking for support to navigate the system, we will refer them to the HSC, Human Services Coalition. So it felt appropriate that the Human Services Coalition, myself, would co-host this, but we are bringing in an expert from the field to help walk us through the system to get us for the music. So I'm going to hand this now over to you, and you can do the introduction.
Thank you so much. And I think, Sarah, are you or Diane going to speak?
Hi, this is Diane. I can speak. I think hopefully you can hear me.
Yes, we can.
Oh, great. Having a little issue with technology, so just wanted to confirm. Thanks so much.
Just let me know when you want me to advance the slides, okay?
Sure, you can go to the next slide. Thank you very much for introducing our Community Health Advocates program. I'm going to talk a little bit about what we do at Community Health Advocates. My name is Diane Spicer, and I'm the supervising attorney of Community Health Advocates. I'm down here in New York City. Thank you for accommodating me virtually. So the Community Health Advocates program is housed at the Community Service Society of New York. We are a nonprofit that has worked with and for New Yorkers since 1843 to promote economic opportunity and champion an equitable city and state. So we have all sorts of programs that help New Yorkers to thrive. And we have a health initiatives department, a whole department devoted to health work. In that department, we have a couple of different health insurance enrollment and consumer assistance, post-enrollment consumer assistance programs, and one of them is the Community Health Advocates program.
I can jump in here, Diane, and just for those who don't know, Human Services Coalition of Tompkins County is our local community health advocate agency. At agency, our mission is to enhance delivery of health and human services in Tompkins County area. And we do that by supporting a vibrant not-for-profit sector. And at our organization, we do a lot of things. We have our 2-on-1 program. We have our health insurance navigators. We do a lot with housing. We have the core continuum of care. And we also do capacity building workshops, forums. We have the Health Planning Council and our Community Health Advocates, which you're here to learn more about today. Back to you, Diane.
Great. Thank you. You can go to the next slide. So this slide just explains a little bit about what CHA is and what we do. We're a one-stop program for healthcare consumers in New York. We offer free assistance related to health coverage and access to care. We help people with any kind of coverage, commercial insurance, Medicaid, Medicare, even people that are uninsured, access care, and we help them with bills. We can speak multiple languages. We serve all 62 counties throughout the state, and we have a live answer helpline, and we provide services through 25 agencies. So you can call our helpline to get assistance anywhere, or you can go to your local organization in order to get help with a health insurance issue or an access to medical care issue. Next slide, please. So this slide is a little bit about our helpline. Our helpline number is 888-614-5400. We are open every business day from 9 to 4. You can reach out to us in multiple different ways, including email, and our information is listed on adverse determination notices and explanation of benefits that you might get from your insurer if you're on commercial insurance or Medicaid, Child Health Plus, Essential Plan. We're also on hospital financial assistance application notices. So we have kind of the word out there for folks to get to us if they need help with denials. And with, as Nicole said, with what's going on lately in the world around denials and the tragedy that happened recently with the United Healthcare executive, this is really a great time for everyone to understand who we are and what we do. We help people through denials every day. Next slide, please. So these are our CHOP providers in Tompkins County, of course, Human Services Coalition, and also we have a CHOP program at Legal Assistance of Western New York. And I'm going to talk a little bit about our CHA services. There are 5 common issues that we help clients to resolve. We help folks get coverage and supplemental coverage. We help them understand and use their coverage. We help them access care, negotiate and reduce their medical bills. And one of the very big things that we do is help with claim denials. So for the first main issue that people come to us for help with, getting coverage, we can help you review your public and private insurance options. If you're uninsured, we can give you advice about whether you're eligible for any public options, whether you should be on Medicare, whether you're eligible for tax credits or Medicaid. We can help you choose between plans, switch from one plan to another, keep coverage if there are barriers to your enrollment, and seek additional coverage to reduce your out-of-pocket costs. So recently, we just finished Medicare open enrollment, and we helped a lot of consumers enroll in the right Medicare Part D prescription drug plan and enroll in a Medicare Advantage plan that could help them to reduce their out-of-pocket costs for the new year. That's just an example there. Next slide, please. And we have Joanne's story about getting additional coverage. Here, Joanne's problem was that the cost of Medicare Part B premiums and her 20% coinsurance for every medical service she got was draining her family financially, right? This is a very common problem for Medicare beneficiaries. Medicare covers 80% of the cost of most Medicare covered services, and then consumers who are in original Medicare have to pay for the 20%. CHA can help folks and helps Joanne and her husband apply for the Medicare Savings Program, which covered the cost of her Part B premiums, and also qualified them for extra help, which helps to reduce her Medicare prescription drug plan costs, so saving her $300 a month. And this is just a quote from Joanne about the help that we gave her and what the additional coverage meant for her. Next slide, please. So we also understand folks, help folks understand and use their health insurance coverage. This is one of the most common things that we do at Community Health Advocates. We can help you understand what services are covered by your plan, what free or preventative care services you can get without cost sharing, what are key terms that you might need to understand in order to understand what the information that you're getting from your plan, what it says and what it means, right? So what is an explanation of benefits? What are in-network providers? How do you make sure that your costs remain low? What are the rules that your plan has or your insurer has for accessing care? Because every different kind of insurance has different rules for how folks can get care with lowest costs. Next slide, please.
And hello, I'm JD. I'm the one of the community health advocates at the Human Services Coalition. And I'm going to tell you a little bit just about some of the people that we've helped there. And this is our friend Janet. And Janet was trying to get all of her documentation and everything done for immigration purposes. And there was an issue with some of the vaccinations and ended up with a bill from a provider's office for $1,400, and it's unsure why and what the case was. So we ended up helping Janet understand what the process was, which took some digging on our part, trying to find the rules and regulations to immigration and what the vaccinations and all of that was going to be. But we helped her understand why, and we helped her to find ways that could help recover the bill, because Janet didn't feel as though that was something that she could do on her own. So we were able to give her some financial help. Okay, so I guess we can find specialists who speak languages. Speak your language. If you're not speaking English, that's fine, because we have ways of looking up providers and finding them in your plan's network. We can help you find durable medical equipment. So if you're looking for canes or walkers or anything, we can help you find where we can get them and how your insurance can cover them. Or if your insurance can cover them, we can help you obtain the prior approvals for your health plan. We know that when you get to the provider's office and they tell you that they want to do a certain thing, and then your insurance company says no, that because your provider's recommending it, you probably definitely want to try to do that. We can help you get the approval for that. This is our friend Kathy. Kathy has difficulty with her English proficiency. People don't understand her very easily, and Kathy doesn't understand some of the Medicare stuff that is coming to her in the mail, and so she brings that into our office, and we go over all of that with her and tell her, help her understand what it's saying. We also help her manage her doctor's appointments and making sure that she's getting to her providers. And when she is done speaking with the provider, if there's something that she doesn't understand or she feels that she doesn't have a good understanding of what was said in the appointment, she would come to us and we help her try to understand it, either by getting back in touch with the provider or hearing what she has to say. Help bring down that language barrier. So we can help you sort through your bills to figure out what you actually owe, to see if there's maybe a mistake, or if there was something that we can maybe reduce because it actually is covered and it just wasn't billed. We can help you with appeal decisions. If if you were given any, right? So if you have them, and we can step in and try to help you get them, get your, even though there is, the denial that was given first. And then we can help you negotiate with your providers to see if we can lower your costs. So just because you don't have coverage and maybe you're choosing not to, we can help you try to lower your medical costs even through that, right? Even if you're just talking with your providers. And if you do have a balance, we want you to help you find out about the balance bill protection and your regular cost sharing amounts. So we're going to look at your plans with you, and we can help you try to determine what it is that you will have to pay, and if there's anything that's being billed that should not have been there due to the balance bill. Okay, and this is our friend Raymond. So if Raymond was laid off of work and then encountered a diagnosis that did leave him with $1,000 in medical costs. So we were able to help Raymond still receive care for the medical issue, and we worked with the provider's office and to help them get the new information for the coverage that was backdated for Raymond, so that his medical bills were covered and he was not left with that out of pocket. So what we can do is if the health plan has denied your coverage, or the coverage of a certain process or process through your doctor's office or medication or anything, we can help you appeal the denial of the claim if the bill was denied from that. And then we can help you file a grievance or complaint if so needed afterwards. And this is our friend Mark. And so Mark was experiencing pain while he was eating, and he was told that he was going to need extensive dental work. But the medical plan that he had was denying it, saying that it wasn't medically necessary. So the Community Health Advocacy Program was able to help him file an appeal and provide evidence of why this actually was medically necessary to help Mark eat well now and license.
And actually, I was gonna also share a personal anecdote from a family member of mine that I referred to CHA, which was kind of similar to our last story. They were looking for dental coverage for some extensive work, and the dentist told them that the coverage was denied. So I referred them to CHA, and CHA contacted to get the denial and found out that it actually wasn't denied. They just assumed it was going to be denied. So they told my family member that it would not be covered. And they said, well, can you just submit it? Because if it's denied, we can go ahead and file an appeal. And they submitted it, and it was approved. So it was just them making that phone call and having that conversation. And you didn't even need to actually go through the appeal process. They actually just had to submit it. They just made an assumption it was going to be denied. So that's why it's really important to always call us and find out, because providers don't always have all the information. They make assumptions.